Thank you. That was perfect. I do have a couple questions / areas I would love to get into. So we kind of talked about the general mindset at the beginning, but something that we sometimes can have a harder time than we wish we did, getting people into that headspace of how do I tell when biofeedback would be a helpful tool? So can you talk a little bit about how you address that?
Yeah, I think that's a great question, and really what I look at it now is I used to take a look at it and say, you know, I was trained on biofeedback a long time back, but really didn't find it overall helpful at the time. For what, I probably didn't know much about it, but it seemed to be a little bit more cumbersome, and I wasn't sure really to put it into my plan of care. Now with the ease of the mTrigger, what I do is I take a look at one on my evaluation, and if I find let's say for immobilization, someone's been immobilized for 10, 12 weeks or whatever they have because of a we use scapholunate ligament or type of thing. They've got that repair, or they got a reconstruction, or even even after 4 to 6 weeks, based on a particular surgical, they come out of of an immobilization or a cast or a splint or whatever they have going on there, and they don't know how to move again. So it's not that they don't have that maybe even the joint motion, but the motor control. We know that even after a few days of immobilization, there's actually changes on the homunculates that show that there's abnormal movement patterns. So I'll do my joint assessment. I'll take a look and see what the problem is, and I'll determine whether it's a stability motor control issue, or if it's are they hypomobile, excuse me. Are they just don't know how to move again at that point? And then if they don't know how to do that, that's when I may go ahead and integrate that mTrigger, the biofeedback, into my plan of care, where I say, okay, we're going to take a look at our uninvolved side, see how that moves. Now we're going to place this on over here. I want you to start reproducing that. And I've even done that in conjunction with mirror box therapy, where we can place the mTrigger on them, and we can place the affected side in the mirror box, pull the app out so they can see the activation of that on the app itself, and then but also see the uninvolved side moving. So it gives a higher level of cortical input. So it's really pretty cool. So that's why I might take a look at it. First, I'd assess that joint. Is it a motor control stability issue, or is it a joint issue where I've got to mobilize that first and then get them into function after we get it moving?
So once you've kind of determined that it would be helpful, can you talk a little bit more about the kind of the nitty gritty of setup? You know, how do you get your goal in the right place? How do you make sure your electrodes are reading what they're supposed to be reading? Just a little bit about getting set up and going.
Yeah. I can honestly say the reason I don't use a lot of stuff sometimes is because I'm not a techie. I'm not very good with high tech stuff, and I am the kind of guy where I've never been able to. I have to do something over and over and over again. I'm very kinesthetic learner, and probably a lot of occupational therapists are. I'm just speaking in general, but this is a very easy setup. So there's a couple ways to do this. There's the one that I've been taught before. Usually there's like the down and dirty, where you put the pads on the muscle bellies, and you have them activate that particular motor unit, and you see the number of microvolts that is on the bar. What you can do is you can set within the unit then at that point, either a little bit higher or a little bit lower based on what you're trying to achieve. And then we can have a documentable objective measure each time when they come back in, whether it be a certain period of time. We can also set it so we can have maybe 3 to 5 seconds of a contraction, or maybe 10 to 15 seconds of a relaxation phase. You can modify those two as well for those that maybe need some more time to relax. I've done that before with some of my individuals that suffered a stroke, where they really need some time to let the soft tissue in the neural system kind of calm down a little bit, so it's not picking up that quote unquote noise on the electrodes. So it's surface EMG, so we want those pads over top of the muscle bellies, right? We want to be able to see that those two pads communicating with each other, and so they can pick up that frequency or that activation. So this is where it's super cool. I can't grasp it, put it around my head. All I know is that it does it. So we slap those two pads on there. And what's great about these smaller pads that they've come out with now, and these little things are I think, awesome. So now I can put them on things like the dorsal first interossei, and I can kick them in that little muscle right there, so I can help them stabilize while they pinch. I can put it on my abductor, digiti minimi, and work on that right there. You can look at a specific, maybe I can really target the ECRB and ECRL a whole lot better than putting on a 2x2 inch pad. But what's great about these pads as well is you can cut these pads right down. So you can fashion them and fit them right to the muscle belly. It's the actual, I think the actual meshing or the actual wire is integrated right in with the pad itself. So we don't have to worry about cutting those pads at all. So pad placement is very important. You want to find out what is not moving as efficiently, place those pads on the muscle bellies and move from there. You can do a neuromuscular deficit test too as well and check the contralateral side to see what the activation is on the opposite side, and even use a single channel or dual channel again to maybe do an antagonist and agonist type of movement pattern, or a function inhibition, where maybe we want to, again, I've mentioned before, maybe we want to work on external rotation and shoulder flexion, but we want to shut down the upper traps, and not us do it, but have them try to focus on relaxation of that particular muscle during the activity. So there's a lot of variability and a lot of different ways we can put this together to make it a very customized plan for each person.
Yeah, I think that's kind of, personally, when I think about mTrigger for occupational therapy, it gets into that. Like, you guys are problem solvers, right? You're physically building tools and simulations and just creating, like you said, solutions that help people get back to function. So it's a really custom program. We get a lot of questions about, where do I start? What am I looking for with mTrigger? What is success?
Right.
And I was wondering then, because in occupational therapy, in hand therapy, you use it in such a specific way for that patient, right? What does success usually look like when mTrigger is kind of part of the equation?
Gotcha. You're right. As occupational therapists, really what our beginning was to engage in activities. And it went from even like early on in World War I or whatever, with crafts, World War II, excuse me, with crafts and those types of things, engaging the whole patient, not only the daily living skills, but the psychology behind it. So we're trained specifically to see the person as a whole instead of cutting them into body parts. And so what we do is this helps to engage those particular units. Let's say if there's a motor unit that's generally weak, and through our evaluation and assessment, yes, we want to make sure that people can use their arm again. That's when many students come into my clinic and they talk about, like, what model do you use of occupational therapy? Do you use this thing called the MOHO or the CAWA model or the PEO models? And I said, we use them all. And we look at the person as a whole. So I don't look at the mTrigger as just one isolated piece of equipment that we can just stick on and use it in a particular, I look at it as something that we can use to engage the patient in a different way than a traditional muscle stim or a traditional passive unit here now. I can engage that into their occupational performance or the activities in the clinic. So what does success look like? Success looks like, to me, when I can put something on like mTrigger biofeedback on an extremity, let's say if they have limited wrist extension, and I'm able to not just engage the motor units, but also engage them cognitively and emotionally within that treatment session, and give them a target and a goal, and now they can carry that over into the home. So when people come back and say to me, "Hey, gosh, I now know what it's like to feel that again. I can actually control that muscle, that motor unit. Now I can link that to function at home." Are there other ways to do it? Sure. This is not an isolated treatment. This is something that becomes part of the treatment program as a whole. It just kind of naturally flows into that. So again, as where some modalities are very, very passive, I find that's exciting about this. It's a very active intervention. And again, not just on the physical end of things, but also the motor control aspect, where they have to get a good efferent output in it through cognitive function. So again, and we can do that through that cognitive function takes not only a look at muscle endurance over time, but also things as visual motor activities. We have to engage that system as well. Balance. Maybe they could do this while they're balancing. Standing at a table and actively trying to raise the shoulder overhead while they're watching, the graph, or while they're playing a game, or a three-dimensional movement with like Powerball, those types of things like that. So again, this whole concept of gamification, to me, has a significant carryover into function, as opposed to just like a complete passive modality. So that's kind of what my overall idea of success looks like. Will it take some time? Absolutely. But again, I think it's much more effective in this manner than it is just having somebody do something to somebody instead of doing something with somebody. And this is what we're doing with mTrigger Biofeedback. We're doing something with someone. There's a perception within the occupational therapy world sometimes that certified hand therapists are not very occupation based. And I'm an occupational therapist. There are physical therapists that are certified hand therapists, but I incorporate function in everything I possibly can.
Mm-hmm.
And really what I liked about, I shouldn't say I like, but I really love about the biofeedback is now I can really engage them on a different level. People love to come and they love to come to therapy and they see this and they're like, this isn't just some kind of boring therapy. They're like, okay, bend the finger, let's get your profundus moving. Who really cares, right? But now they're like, I can plop these on, maybe let's say in the flexors on the wrist in the area. Now I can say to them, okay, we're going to get this going, but I want you to check this out. I want you to make that bicycle jump. Now all of a sudden, I've got a new dimension to my therapy. I've got this new level where am I still doing the same things beforehand? Yeah, but I'm doing it now more with a purpose, and I'm doing it more with fun. And we always say, well, we put the fun in function, kind of cliche, but anyways, we have a good time. And then they have much greater buy into their home program and they become more involved in the therapy session. So when we do that, it's a game changer to me, because I've seen many a clinic where they come in and like, oh, dip you in the paraffin. Okay, we'll do some blocking exercises. Okay, we'll see you next week. Now that's no good. Okay, it's not therapy. So now I've just taken their $30 copay and whatever their insurance is for them to do something they could have done at home. So I want to do the stuff they can't do at home in my clinic. People want to come. My schedule's packed most of the time, not because I'm the greatest guy in the world, but because I'm engaged. I engage the patient in their home program, and that makes for an effective overall treatment. So this is what's really cool. I think this biofeedback, you should be selling the stuff like hotcakes, if you ask me. But many times we don't know we have these abnormal movement patterns until someone brings them out and shows us. So once they do that, they say, hey, you're tilting here to the side. So if we're looking at trunk control at the same time, maybe now we can use this to engage, those external obliques a little bit. We can put that on and say, okay, I want you to lean to the left a little bit, kick that in over there. Watch you check out the meter here, and I want you to make that light go right up at the green level right there. So now, yes, we've got some visual feedback, and now we're increasing that. We're actually having them feel that, and they don't even know what that might feel like anymore. I said, I want you to squeeze that muscle, make a muscle, and when they do that, they get the make a muscle thing. When they get that, now they can put that into, there's a challenge. They have a number to get to on the meter, or they have to kick in that particular thing to move the bike, and then they have to sustain it and hold it there for a period of time and get the big visual feedback at the same time. So again, that making that value every rep, because it does take on a great significant importance, because it really helps them to become part of the overall treatment program. I feel that we've been passive for too long. We come in, we do something passive, we put a hop back on somebody, we do something to them, and then we'll see you later. I don't want to treat like that. I want to have that patient engaged in that process. So this, like they said, the mTrigger biofeedback really helps to engage them in that treatment session in a different way that we haven't done in the past. So
awesome.
Pretty cool. Yeah.
Kind of to go off of that, my last question was, what is the response you see from patients? Like I know you said that, some patients don't necessarily love the games, but they might engage really well with the feedback meter or the audio.
Mm-hmm.
But in general, what is the patient response to that visual feedback, to those, attainable goals in real time and over time?
Yeah, and again, I take a look at it as occupational therapists. Again, everyone is from a different place. So I have some of our older population, our elderly population. This is just a generalization. I've had this happen. They don't maybe like the video game aspect of certain things. So they might do better with the meter. They'll take a look at that and say, oh gosh, I have a goal right here and I'm going to hit that every time. Or someone who's very task oriented. So he does something to just tell me what I got to do and I'll get it done. So as occupational therapists, again, part of what we do is not just assess a biomechanical aspect of things, but we take a look at the psychosocial end of things. We engage them where they're at and say, what are we going to be able, how can we modify a treatment session to help them achieve their goals? So again, and we may have to modify that modality. Well, here you can in various ways. So maybe our younger generation who might like the video game aspect of things. There's some great video games that they can, or I say video games, but games that they can connect to that will encourage particular movement patterns, such as, again, the bicycle there. They hit that ramp and up they go, and we can keep it for a period of time, or even our pediatric population, whether it be CP, those types of things, to engage them in something that is more age appropriate for them, or will interest them. Some people just don't want to look at a meter and have that go. Other people are really into it. So it allows me the versatility. And again, sometimes I try that and someone says, I don't really like that. So we'll try something a little different. They're like, oh, this is really cool. I can really I can get into this for you.